Okay, hello everyone. Thanks for joining. Thanks for joining me live today. Here I have hello everyone. Welcome. I have a couple of one interesting topic came up this week as I was talking with a clinician about the impact of antimicrobials on the stool biomarkers in the GIFX comprehensive, which let me give you a little bit of background. The GIFX comprehensive, if you're not familiar with it, it's a stool test which will give you some information about digestion, absorption, inflammation, immune responses in the gut, and also microbial balance in the gut. So looking at the microbiome, and so it's one of our stool tests, which is one of our most popular profiles, but it will give you a lot of insight into what's going on in gut function. So as I was talking with this clinician in a consult this week, the clinician said, "Well, this patient took antimicrobials a couple weeks ago for a sinus infection, and or some kind of infection. Wasn't entirely clear, but took antimicrobials provided by another provider." And what impact would that have here in the GIFX profile? So we talked about that, and that was sort of the got me thinking. Well, maybe that is a question that comes up a lot. So I figured I'd share with you some impacts of things to think about, things that you might see in the GIFX comprehensive after somebody takes a course of antibiotics. And the fact is, antibiotics will have an impact on the commensal bacteria in the gut. The bacteria we expect to see in the gut will have a big impact on that. And usually it will have a blunting effect on the overall commensal bacteria. But the effects go a little bit beyond that, because we will also see impacts in things like short chain fatty acids, which are metabolites from the gut bacteria. When the gut bacteria metabolize fiber or ferment fiber, they produce short chain fatty acids. You could also see low levels of beta glucuronidase, which is also a byproduct in a way of the gut bacteria. So if we've wiped out some of the gut bacteria, there's less potential to make beta glucuronidase. You might also see some yeast show up. So often when we treat with antibiotics, the patient, in wiping out some of the good gut bacteria, the good gut flora, there's more opportunity to develop problems with yeast. So that's pretty common. I'm sure a lot of you have seen that. And so you might see yeast show up if somebody's been on a long course of antibiotics. You could even see parasitology being impacted. So parasites might, because we use some antibiotics to treat parasites, like metronidazole, for instance, that might show a negative parasite result. So those are some of the impacts, and there are some other considerations, like whether or not the antimicrobial is a prescriptive agent or a natural agent. Generally, the prescriptive agents will be a little bit tougher on the gut. Things like vancomycin, for instance, could potentially impact the Firmicutes phylum a little bit more. And the Firmicutes phylum is a group of bacteria that contain things like lactobacillus. So you might see a stronger impact in certain phyla, but generally, whether it's a prescriptive agent or a natural agent, you'll usually see some sort of blunting effect on the commensal bacteria. And aside from those biomarkers, you might see the total commensal abundance on the second page of the GIFX. You might see that a little bit lower than the healthy cohort. So that would mean that there's less commensal bacteria there. You might also see, I've seen beta glucuronidase low quite a bit in patients who've had antibiotics within the last 12 months even. So the effects could be quite long-standing. And that partly depends on how well the patient does at getting more fiber and probiotics and sort of repleting and rebuilding the commensal bacteria after a course of antibiotics. So let's see here. Any questions? Hi, everyone. Thanks for joining us. I see a lot of waves on Instagram, so thanks. Also, too, one other thing I should mention while we're on the same discussion is the collection instructions for the GI-FX Comprehensive. They will say wait 2 to 4 weeks after a course of antibiotics to test, and that will give you a better chance at seeing some stabilization in the commensal bacteria. So if you're testing within 2 to 4 weeks of a course of antibiotics or antimicrobials, you might still be seeing some influence from those. So that's definitely worth keeping in mind. And the kit instructions or the collection instructions will mention that 2 to 4 week time frame, which will give you enough time to, or usually will give enough time for the commensal bacteria to stabilize somewhat. So I don't see any other questions here on Instagram or in Facebook. And let's see here if I can check one other thing here. Comments. Okay. Yeah, I don't see any. I'm kind of new to Facebook and Instagram, so I'll try to figure this out more so as we go along. But thanks for joining us for the last few weeks. We've been doing these videos. Hopefully they've been helpful. One other thing I should mention is that stool test that we mentioned is something that the patient can collect at home, so it fits with our Stay Safe Collect from Home initiative. And so you can arrange for us to have a kit sent directly to the patient. Patient collects. It comes with a prepaid FedEx envelope so that they can send that specimen back to us. The lab will run that and we'll issue the result to you. And if you have questions about it, you're always welcome to give us a call. You can set up some time with myself or any of the other medical education specialists here at Genova. We'd be happy to help. You can also take a look at our website. We have a lot of resources for interpreting on the website as well. So that's www.gdx.net. Our number, if you wanted to schedule a MedEd call with us, is 800-522-4762. And if you have questions about the biomarkers that would be impacted on the GI-FX by an antimicrobial, if you want to see that again, if you're late joining us to the video, you can send us an email at info@gdx.net. So hopefully that's helpful. Thanks for tuning in, and I look forward to catching up with you again next week. Take care, everyone. Bye.